Now returning to the fight against cancer, 2 new studies report dramatic progress in treating advanced melanoma and lung cancer. Both of these treatments use an approach that is creating a lot of excitement among doctors, tailoring drugs to the genetic makeup of individual patients. Dr. Jon LaPook found that the results can be remarkable.
In 2007, Bill Schutte was diagnosed with advanced lung cancer. 7 different chemotherapies failed. He was told nothing more could be done.
I basically was looking at going to go home and make arrangements, is what the doctors basically told me to do.
But then he heard about something new, an experimental drug that targets a certain type of lung cancer based on its genetic makeup. Tests showed he was a candidate. His rare form of non-small cell cancer has a genetic mutation called ALK that fuels cancer growth. The new drug, crizotinib, works by blocking this abnormal gene, causing tumors to shrink.
One of the very first things they'll tell me is how much they feel. They feel so much better after starting on the drug, and they feel so much better than they ever did when they were on chemotherapy.
In preliminary results presented over the weekend, more than half the patients were alive after 2 years. That's more than 4 times the usual survival rate.
I'm able to get back on the bike. I'm doing a lot of swimming, walking, hiking, and I'm hoping to do one of my first major bike rides here in September.
This drug only works for the 4% of patients with this kind of lung cancer. That may not sound like much, but this is the future for all cancers, finding treatments that may work for only a fraction of patients, but that work very well.
John, what is the future of this therapy?
Well, Scott, it used to be if you had lung cancer, we'd say, this is your treatment. Breast cancer, that's your treatment. And now we're saying, wait a second, what kind of lung cancer? What do the genes look like? What are its molecular Achilles heels? And then tailoring treatment. It may turn out that there are 20 different treatments for lung cancer and 20 different ones for breast cancer. That's okay. They're more specific, they're more tailored, and ultimately they'll be a lot more effective.
Thank you, John.